Workplace violence in healthcare is a serious and escalating issue. Per the U.S. Bureau of Labor and Statistics, healthcare and social assistant workers have the highest incidence for workplace violence out of any other private industry. Accompanying the increase in violence is the expectation that these actions are to be tolerated as part of the job. Healthcare workers have the same protections as standard citizens. Healthcare workers are disproportionately affected by workplace violence, and in 2018, healthcare workers were 73% of the reported non-fatal workplace injuries due to violence. The American College of Emergency Physicians reported that 91% of their doctors stated they had personally experienced violence in the workplace or their colleague was a victim, with 40% reporting of a known attack that led to severe disability or death. Of the total healthcare violence cases reported by the U.S. Bureau of Labor and Statistics, 69% required leave from their job due to injuries and 30.9% required a job transfer or restrictions. Workplace violence can cause stress, anxiety, physical injuries, and psychological trauma. Ultimately, this can cause burnout, and that leads to medical errors, decreased patient satisfaction, and decreased productivity. And all these negative consequences result in staff leaving healthcare and adding to the staffing shortage that is already experienced by hospitals. The average cost of a turnover for a bedside nurse is over $40,000. This results in hospital losses of anywhere from $3.6 million to $6.5 million per year. This adds to our rising healthcare costs and decreases in quality of care. Assault is a crime, but rarely is assault on healthcare workers prosecuted. There's currently no federal law specifically protecting healthcare workers. This leads to underreporting due to the lack of consequences proportional to the amount of time and paperwork that the reporting needs done. A federal bill named Save Healthcare Workers Act, also known as the SAVE Act, was recently introduced in both the House of Representatives and Senate committees. It seeks to make attacks on healthcare workers a federal crime and calls for federal prison sentences for up to 10 years with more serious crimes that are punishable for up to 20 years. This legislation is essential to help deter workplace violence in healthcare settings by establishing clear federal penalties for assault and intimidation. It would help support frontline workers by signaling that their safety is a national priority. It would close a legislative gap by aligning protections for healthcare employees with those already in place for other public service professionals. And it will improve healthcare retention and reduce burnout by addressing one of the top causes of job dissatisfaction, which is fear for personal safety. Healthcare workers are the backbone of our national health infrastructure, and it is unacceptable that they remain vulnerable to violence while serving their communities.